Have you wondered if uterine artery embolization is right for you? What does it mean and how does it work? Well, watch till the end of this video and I've got all the information that you need to have about uterine artery embolization to make your decision about whether it's the right treatment for you in managing your fibroids. Hey there, I'm Dr. Sylvia. I'm a general practitioner, author, and the founder of Askawayhealth, where we provide you with direction and clarity about everything medical. Subscribe to our channel, and when you do, don't forget to click that notification bell so that every time we publish a new video, we tend to be once a week on Saturdays, you'll be the first to find out about it. So fibroids are a fairly common problem that women have. We know it can affect up to 30% and more of women around the world, particularly those of African origin. So there are issues around the diagnosis of fibroids and the treatment of fibroids with a range of different options that can suit one lady to the next. We have a fantastic series of videos in our playlist about fibroids, so I'd really encourage you to check it out. I've put the link in the description as well. So have a look at those if you want to know what are fibroids, what other treatment options there are. But today we're looking at a procedure, a minimally invasive procedure called uterine artery or uterine fibroid embolization. So to describe it as simply as possible, uterine artery embolization is a way of blocking the blood supply to the womb in order to target the areas where a fibroid is growing. In more detail, it involves cannulating the femoral artery, that's the big artery in the leg, which goes into the uterine arteries that actually supply the womb, and injecting them with an embolic agent, which means that it's something that's going to block or close off that artery and hinder or prevent the supply of blood towards that part of the womb. So altogether, when you consider the size of the fibroid, the number of fibroids present, its location within the womb, any symptoms that the fibroid causes, any other medical problems that the woman might have, if you consider the woman's preference, and if the fibroid is at least 3 centimeters or bigger, uterine artery embolization should be amongst the treatment options that I would offer or that a woman should consider when looking at how to treat and manage fibroids properly. A little bit of history. Uterine artery embolization was first carried out in France in the early 90s, and since then it's spread around to other parts of the world. For example, in 2010 in Maiduguri, northern Nigeria, uterine artery embolization was successfully carried out at one of the teaching hospitals. So let's look at the process of uterine fibroid embolization. First, I'd like you to know that it's a specialist procedure. It's carried out by a specialist doctor who is known as an interventional radiologist. Now, an interventional radiologist is a medical specialist who uses radiological images, x-rays, CT scans, MRIs, etc. to identify and treat medical conditions in the body. So not every doctor has this skill. An interventional radiologist would have gone through a lot of training and should have gone through a lot of these procedures to be referred to as an expert in that field. It is usually conducted under local anesthesia, so you're not put to sleep, but you'll also be given some medication to help you relax or to help with pain. So when you're settled and comfortable, your radiologist will locate your right femoral artery, and it is through that artery that a cannula, that is a needle, is going to be introduced, and that's where the agent for causing the embolization will be passed through. Through the cannula that's gone into your femoral artery, a thin tube is passed into the arteries that supply the womb. They're called the uterine arteries. Halfway along the length of the uterine artery, the radiologist will inject material, a fine particle called PVA, polyvinyl alcohol. It's an inert, that is inactive material that has been in use for several years in treating other medical conditions. Now this chemical PVA, like I said, is made of fine particles that are injected into the artery. They'll be carried along the artery, along the blood, with the blood flow into the womb, and along to the smaller blood vessels that supply the fibroid. So these blood vessels get blocked, and what that means is that the blood supply to the fibroid is stopped. So that means we're depriving the fibroid itself of any nutrients, and it stops growing. As a result, eventually the fibroid is going to shrink and die off. Now PVA itself, like I've mentioned, is harmless. It's disintegrated and removed from the body the way that usual waste is excreted from the body. It doesn't cause any harm.